Tell us about the latest technologies of diagnosis with autism.
As we mentioned in the previous question, that early diagnosis is very important in the outcome for this disorder. Diagnosing autism is one of the most difficult issue that face both healthcare professionals and the families at the same time. It usually takes a very long time because the family first go and seek the advice of their pediatrician, and the pediatrician will refer them to the neurodevelopmental specialist, and this usually in all these cases there is a very long waiting list which might take years in order to reach the diagnosis. There are, of course, certain diagnostic tools and screening tools that help in detecting this, some of the signs and symptoms of these disorders. And the most important screening tools, we have what is called the MChat and the chat and the social communication questionnaires. And these are a set of questionnaires usually the professionals do with the family of the child with this disorder. And now the available facilities or tools for diagnosing autism, there are two main tools. We call them, or we refer them sometimes as the golden tools to diagnose autism. The first one, we call it the autism, the ADIR, Autism Diagnostic Interview, revised. And this includes sitting with the mother or father of the affected individual, and they ask around 94 questions about the history of the signs and symptoms. It is usually a very long session. It takes around 3 to 4 hours, and the scores and the algorithm needs a very well experienced professionals to do that. The next diagnostic tool, which is mainly clinical, we call it the ADOS, which is the Autism Diagnostic Interview Schedule. This one, usually we sit with the kids and the family, the father and the mother, and we will interact with the children with around 10 to 12 different schedules to play with the kids, to show him, to ask him some questions, to tell him to do certain activities. And of course, we will score all these activities. Usually this test takes around 45 to 60 minutes, and it needs very experienced professionals to do that. It's a subjective, which means that the results of the test depends on the experience of the person doing the test. And usually it's a time-consuming one, and very few centers will do that. The main criteria, we have what's called the Autism Diagnostic Criteria, ADSM-5, which is set by the American Psychiatric Association. And these are criteria where the clinician or the psychologist sit with the family, taking history, and also sit with the individual and see whether the symptoms and signs go with these criteria. Nowadays, there are so many research going on to find a better, more objective methods for the diagnosis. And one of the most, promising technique is the eye tracking test to diagnose autism. The idea of this technology depends on most or all of the cases with ASD. Individuals with ASD have certain deficit in eye gaze. There is a very, what we call it, poor eye contact. If you try to talk or connect with an individual with autism, usually he rarely focus on your eyes. He usually, maybe he look at you for a very, very short time, and then he will look around you, and what we call it a poor eye contact. So that device, the eye tracking device, usually it will track the movement of the eye by showing the individual certain, what we call it, either still photos or a very short videos, and see how his eyes will react with those stimuli. And at the end, of course, it will give us the results and the score, what we call it sometimes the autism risk or autism index, and we can see whether that individual falls in the category of autism spectrum, in that spectrum, or he is on the clear. And the research, of course, there are so many number of institutes started with this research, and one of the most prominent one is Cleveland Clinic, the USA. They started it in 2014, and we were glad to have that opportunity to work with them and collaborate with them to develop the same technology, but that fits our Arabic culture. And we were able to develop a very good test, and we published 3 papers on that, and we did the validation, and also we created the technology in Arabic, which means that it fits the Arabic speaking community, and it only takes around 3 minutes. So imagine, months of waiting to consult the physicians to do the diagnosis. Now it's only take a few minutes to have a very good idea as an objective tool. And this is very important because it doesn't depend on the experience of the person doing the test. So, and of course, there are some other technologies that usually check the expression of the face of the individual, his movements, the sounds and voices when he communicates with the other individuals to help in the diagnosis. And nowadays we have we are doing research project for an American company, Argos Cognitive, to try to add more what is called the artificial intelligence and machine learning to the ADOS testing, where they put some cameras to follow the expression of the individual during the test, and also some eye tracker, and to gather all this information, which adds more objectivity to the test. These are the main new technologies that help in screening and diagnosis of autism.